Hi everyone, good evening. I'm Dr. Karishma and we are on our Men's Monday live. So a lot of apologies for last Monday. We had certain circumstances due to which we couldn't go live, but we want to continue our topic and talk about gender dysphoria. And I'm just waiting for a few people to join in. Hi everyone, thank you for joining. Let's take Navid on to our live session right now. Uh, yeah, there are quite a few people joining us. Hi, everyone. Good evening. Hi, Navid.
Hi, sorry everyone who's here. Like I said, we Bangaloreans blame everything on traffic. I'm going to blame this on traffic as well. I overestimated that I'm going to reach on time, but from the car, luckily the connection is good. Men's Monday
Great.
is live with Dr. Karishma right here, and we're going to continue, like Doctor said, our topic
Right.
on gender dysphoria. Over to you. Even
Yes.
if my connection is bad, apologies. You guys continue, but I would
No
try and
problem,
contribute to the
Navid.
chat.
No problem. Right now we have a good connection, and before I hope the connection continues. We have two very special guests on our live session today, and I would immediately like to call on our first guest. She is actually a patient of mine. I have treated her, and she is someone who I would like to invite, and she can talk about herself and give all of us a little insight about what she felt when she needed to come out, be confident in her skin and be confident about who she is or what she feels like and what she's all about. So I am going to, Navid, I'm just going to add on my patient live. So is there any way that we can add a person? I'm really bad at this.
Yeah, no problem. If I can see if your patient
Uh-huh.
is on live viewing us right now,
Okay.
she can
Yeah, I
send me a
have just
request, or she can even
invited
send me a
her.
hi. She can even send a
Okay,
hi
I've
on.
just invited. I've
Wonderful,
invited her
wonderful.
to join.
I think she's joining.
Yeah.
I think she's joining. There she is.
Hi.
Hello. Hi. Good evening.
Hi, good evening. Medha, this is Naved. Naved, this is Medha. And she's a wonderful patient of mine. And, Medha, I would like to ask you and tell everyone, we are all talking about gender dysphoria. And, there is so much of confusion around it. To be honest, me as a plastic surgeon also, and when I got into this field, I did a lot of studying and research into, about gender dysphoria, and there is a lot of confusion amongst the laymen. And just tell us something about what do you feel, or when did you feel like this is something you are, and this is what you are all about?
Well, okay, thank you for having me. I'd first of all like to start off by saying that I identify as gender non-binary. So, it's actually more like gender fluid. Um, and I do use the pronouns they, them. Um, I know that you described gender dysphoria in your previous session, so that was a great starter to this one. I think, most people who face gender dysphoria have it from the very beginning, but they just don't know what they're feeling because there's not much information out there about gender dysphoria. Um, I've always felt uncomfortable with certain aspects, especially my chest, right? And that's what I came to you for. I came to you for a top surgery. Um, and I feel like it's society that sort of makes it so difficult for people to figure out that they have gender dysphoria because you're confined in that little box of what you are supposed to be.
Right.
So yeah, I think one always knows right from the beginning, but it just takes some time to figure it out. And for me personally, I figured it out about three years ago.
Okay. Okay. So when about 3 years back, as you said, you figured it out, and what were the thoughts behind you? Was there anybody to guide you, or you went to, or who did you approach? I mean, what made you realize this?
Well, I think the internet was my best friend then, and I sort of Googled things and read up. I took quizzes, which are probably the worst way of figuring out, but they have these quizzes online, and I just read up a lot
Okay.
about it because I wasn't sure. what I was sensing. But I also went for therapy, and I think that's really important. Like if you visit a psychologist or a therapist, they can help guide you on, figuring yourself out and help you understand what you're feeling.
Right. So, and how easy or how difficult was it, to come out to your parents or, to your friends, just your social circle? I mean, how did you manage to do that? And it is a very brave step, and, it's not so easy, I'm sure.
Yeah, well, luckily for me, I think 80% of my social circle is people from the community, so they did
Okay.
understand. But I
Right.
also have a lot of friends from college and from work who are, straight people who are not from the community. So I think you just have to gauge, their reaction to it, and then eventually you just tell them if you trust them, and if they continue to be your friend, then that's great. But if they don't, then it was not worth it in the first place. If they can't accept you for who you are, and
Right.
anybody for that matter. For me, coming out to my parents in terms of my gender was not very easy. It took some time for them to understand, and that's completely normal, because it's normal when people of a different generation don't understand something like this. There's not much information out there for
Right.
them, but I think you
Yeah.
just have to have some patience and try and explain it to them, and send them some articles to read. They
Right.
can even talk to your therapist if they really need to, and
Right.
that way I think they'll come to terms with it slowly.
Yeah, so many people believe that, it's a dictum that, you have to meet a counselor or a psychiatrist, you have to go through hormone therapy. As you said that you feel you're non-binary. So, you did not go through the hormone therapy and still you wanted top surgery. So, like in my last session, Navid, I was saying that as per the usual law,
Right.
the rule is, one must undergo, counseling, then hormonal therapy, and then we look at gender reassignment procedures. But
Right.
in the case of Medha, she identifies herself as a non-binary. It's not necessary that they want to do the hormone treatment. In that case, it is difficult, it is challenging for us as a surgeon also. But then, this is where her counselor or the person's counselor and the psychiatrist helps us, because they understand the person's emotional psychology and the physical want, the mental desire, all of that put together. And that's why we went ahead and did the procedure, because I was confident after, with Medha, that yes, this is what will make her happy. And, so how did, I mean, I'm sure you took the step yourself. You're really young. It's not easy for even regular people to do regular plastic surgeries. So how was, just quickly tell us, what was your experience with the whole top surgery? And I'm sure people want to know, I mean, there can be issues also about, with the procedure. So you tell us in your words, how was your whole experience? And
Well, my experience is really great. I want to thank you and your entire team for, the experience that I've had with my top surgery. I think the greatest thing is the fact that you are so open to it, and I was able to talk to you about it, and you understood, and you validated me and what I felt, and you trusted me. So I think for us that's very important, right? Trust. Because yes,
right,
we go to a counselor, we go to a psychiatrist, but that is just because it's required as per law, right? As per
right,
the
right.
procedure. But
Yeah,
we don't need somebody else to tell us what we feel or who we are. We don't need that,
right,
right?
right,
So it was really great that you actually believe that too, and you validated that.
right, right,
um and speaking from a pure procedure point, it was really smooth. It was very comfortable. I'm very happy with the results. It's totally changed my life. I don't have dysphoria anymore like I used to, and it's very difficult for dysphoria to go away fully. It goes away in stages, but I would say that it's gone away. Most of it has just gone away for me. So
right, right.
that's
Yeah.
really great. Yeah.
No, I mean, from when I saw you first a year back and now, I can see that confidence in you, and I can see, the fact that you're right now here live with us, which is not easy for most people, and I should be thankful and, grateful to you for actually being with us. And while you are, Naveed, can we also call another special guest of us? She's a very flamboyant lady everyone knows, and that is Queen Andro. And can we add her also on the
Yeah,
live?
we can
While,
add. Let me invite her. While we
yeah,
are there,
yeah.
Meda, thank you so much for being with us. I couldn't really thank you while the live was on. As you can
Meda,
see, I'm
thank you
taking the
so
live,
much. And
and
I hope you're doing well, and lots of love. And thank you for joining us tonight. You've really, enlightened us with your thoughts and your experience.
but
Thank you
Meda,
for having me.
you can say live. You can say live with Queen Andrew as well. We can
Yeah,
take four for live as well. So
yeah,
let me kind of
yeah.
quickly invite um, Queen Andrew. If you're live, can you give me a sign? Uh,
I've given her, sent her an invite too.
yeah, I've also done that. And but meanwhile, Medha, while the live is on, I just wanted to ask you from a, see, I'm an ally. Hey, here she is, and
Hi
so
guys,
we'll
what's
continue this,
up?
Medha.
1 second. Yeah. Hi y'all. Let me fix my
Hi.
lighting a bit. How are
Hello,
you
how are
guys?
you?
Hi.
We're
Wonderful. See,
doing good. We're doing good.
so the screen just brightened up, Queen Andrew. Thank you for being here and talking to us. As you can see, I'm from the car. Everyone knows that I've got stuck in the traffic, but in
Yeah.
Bangalore, it's excused. So yeah. So yes, Dr. Karishma, over to you.
Yeah.
And Queen Andrew, like you said, everyone knows. She has been the face of the community, face of the fashion for that sake as well, and leading the way right from the top. With her fashion sensibilities, she's all over Mintra. She's all over judging the fashion, pigeons and all that. So amazing achievements, and it comes with amazing confidence that you carry.
Thank you so much for like kind words, Naveed.
This failing, but over to you.
And so
No,
Queen
no,
Andrew,
over to
we
Doctor.
also have Medha with us, and
Hi
she is one
Meena.
of my patients. And she, underwent gender reassignment, her top surgery with me. But as we were talking, she also was not keen on undergoing the whole hormone treatment and all of that, but she has taken, and she's come out just a few years back, and she's gone through that entire phase, and she's now as confident. And please, you can tell us, or share with Neda and all of us, as how you grew into the confident self that you are, and comfortable with it, and how did you figure out, or
First of all, it's Medha, right? Medha.
Yes.
Yes.
Amazing. More power to you. And like, it takes a lot of courage for someone to like, choose your own authentic path, and like, like kudos to you for that and living your authentic life. And
Thank you.
yeah, as far as my own personal journey is concerned, I mean, I have always, I don't know, like, I've always been like, ever since I remember, I always kind of knew okay, I guess Naved wants to be added back on the
Okay.
live. Yeah.
I madam.
Yeah. Let's get him
Yeah.
back and we can
Yeah.
continue.
Yeah. I have added him.
Yes. So yeah, I mean, as far as my journey is concerned, I feel like ever since I was a kid, I always like knew that I necessarily did not know what I identified as, but I just knew that because I was in an all boys school, and I clearly knew that I wanted
Wow.
different stuff in life, and I gravitated towards like other things. And ever since I was a kid, I always had this thing about me that I took a lot of things in life as humor, and that actually helped me a lot in my life, like as I grew as well. And yeah, and just because of the fact that I have a certain type of personality, it was considerably easier for me to embrace whatever I was experiencing and what I was, you know, with while growing up, especially, you know, you start questioning yourself a lot as you grow up. And because your body is changing, and especially when your gender identity is different from your own biological sex, you do start questioning a lot of stuff when you start growing, when you hit puberty. And you know, I mean, I was just talking to you, right, doctor? Like, I used to do a lot
Yeah.
of shit to just like curb all of my masculinity as I grew. And
Yes.
I mean, yeah, thanks for makeup and all of that stuff. But yeah, that has been my journey so far. Just being authentic and unapologetic, and about my own identity.
But have there been
Both,
any, the phases, or do you know, friends in your community where they have gone through, like I see Medha's experience rather comfortable, your experience has been rather comfortable, but I've met so many people who have a lot of depressive phases,
Oh yes.
and did you go through that, or do you know friends, and was there anybody to help them out in all of
Of
this?
course, like, so the thing is,
yeah,
I'm
exactly my
not
point
saying.
as well. Both of you know, yeah, both of you. I mean, Queen Andrew and Medha, both of you are super confident and so much clear in your thought. That we want this and we have got this. But a lot of out there, either they don't have the support or they don't have that kind of clarity of thought that both of you have. I would say the guys who would watch this later, what should be their take? Because not everyone's as fortunate to have the kind of support or clarity like both of you have. Like, so look at you, super confident right from beginning. You knew what you wanted. So what would be your? I'm sure a lot of people approach you with their issues as well and say, hey, how did you manage it, and how should they actually tackle it?
I feel like personally, like, all I can say, so I'm not saying that it wasn't difficult for me as well. There were definitely times when I would have these, like, moments. I do remember moments where I have, like, obviously thought about stuff, and like, I would often think, like, at times that my life would be so much easier if literally, like, I would just be a cisgendered person and just a heterosexual. My life would be so much more easier. But then, yeah, we all have those moments. I guess the main thing is, like, obviously your surrounding, your setting, and your own personality as well, your own mind. Some people, obviously, not everyone can handle a lot of stress, and they have different ways of channeling their stress and their, like, struggles. And yes, I do, like, so many of my friends from the queer community, obviously, they take it in a very different way. And all I can say is just to be patient with yourself, and, like, at the end of the day, we just got to be there for each other, and, like, just support one another. Like, just a call and, like, talking nonsense can help someone so much, like. And most of my friends from the queer community, we've, like, stuck around. My best friend is from the queer community. Like, two of my friends who I've known for the longest time, since I was, like, one of my friends since I was, like, a kid, like, literally 3-year old, and the other friend from my third standard. We've been there for each other. And I feel like queer communities, we have, like, something known as chosen families, who are literally like families away from home. And that is what is, like, the source of, like, biggest strength for us. And that's just amazing.
Yeah,
Yeah,
I
I would
think
also
you
like to add.
summarized it. Yeah, Medha, tell us.
Yeah,
Yeah.
I would also like to add that, I think some of us have the privilege to have supportive environments, and that doesn't make us stronger. I think those who go through the struggle are actually stronger, because, they have to face so many more hurdle. And I also feel like not everybody has access to the same resources. We have to consider the intersectionality of things,
Right.
financially, socially, and many other aspects. And it
Of
depends
course.
from which gender to which gender you want to transition, which is easier, which is not. So yeah, I mean,
Yeah.
just adding that point there, I think
Yeah.
everyone is immensely strong who's going through something like
So,
this.
so conscious of doctor your time as well, but there's a very related question but with what Medha actually also spoke and said that, could you also
Yeah,
talk about, there's a question which says that, could you also talk about challenges trans folks face when they're not
yeah,
financially independent and yet they
yeah.
want to go undergo a surgery? Are
So,
there certain, yeah,
there are a lot of NGOs. There's a lot of NGOs which are present for the, the community and where they can join. There are these NGOs on Facebook, and the community collectively. Like I had a bunch of few patients who had come, and they wanted to, transform from male to female or a female to male, and they came like a community themselves. So they all had chipped in, helped each other, and as Queen Andro said, they have their family and their support groups, and they're all bunch of people if they didn't get support from home. And personally, at my clinic, and for those who have come and who are socially and economically a little backward, we make sure that we give the procedures as reasonable as possible to them. And
some,
a
I mean,
couple of them
if
we
you
have.
want, yeah, if you have some, I mean, guys watching it live, if you have somebody who you think needs it and is financially challenged, please reach out to me or
Yes.
Dr. Karishma. We
And
will
there have also
try
been
and help
few
you as
people who
best
have
we
had
can.
insurance. So what we've done is, instead of trying to put it as plastic surgery, we have made the procedures look more like a general surgery aspect and tried our best to give them partly insurance. And if they come to us with a real dire need and necessity, and we know that they're not economically, I have a lot of other plastic surgery colleagues, at least me in my clinic, and we make sure for that group of people, I have done almost, like, literally the procedure almost free, you can say. Like, I've negated my surgeon's fees. Maybe it is just some consumables. So there are options, and there are a lot of NGOs that I know. So if anyone is looking forward for it, there are people who can sponsor you. And it's all about how much they really wanted. And if I have sent them to a couple of our counselor, my colleagues, and I do tell my counselors also, if possible, like, try to make it as reasonable, the consultations, etc. So for those who are affording, it's fine, but those who are not, there are a lot of options. And definitely we can chip in, and if they're looking for it, and if if you guys know people who are really wanting this, then tell them to approach us, and it's possible. It's possible.
So much respect, doctor. So much respect for that. Yeah. All
So,
right.
thank you, Medha. I think we had a really good conversation, and I'm happy that, we saw two different viewpoints, from Medha and from Queen. And I think the people out there are probably a little more now aware about, since our last live and this time, I think it's made it a little more precise for everybody. And it's absolutely okay. People should know that, it's okay. And there are a lot of us out there to support you, So it's, build your own family. And I think one has to, be confident like you guys. And I'm sure it's not been easy, but wherever I think Medha and Queen, you guys are right now at, I think it's an amazing stage of your life. And I think it's
Yes,
amazing.
and thank you
Hats
so
off to
much.
you.
The what really matters is the conversations that happen, and we'll keep doing these conversations, and people will keep opening up to the thing. It's a step, and thank you so much for being part of this conversation, both Queen Andrew and Medha, and Doctor, of course. So much respect to you.
Yeah.
Thank
For
you
you
all.
guys to host this and, like, talk about it, it's amazing. And thank you guys for having me as
Thank
well.
you. Thank you for having this.
Thank you all
Bye.
for watching. See you soon. See you, Navid. Bye.
Bye.